Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know, I am MD in Ayurvedic medicine and MD in Ayurvedic physiology, that is Kaya Chikitsa and Kriya Shari. And I am taking some lectures like, for example, 5 subjects, Roga Nidan, Vikriti Vidyan, and then also this 3 Roga Vidyan, Prasuti Tantra, Bala Roga Vidyan, Charakuttarardha, and also Swastha Vritta. So this lecture is regarding the Roga Nidan subject. This is very interesting subject because when you go to the hospital, you will have to see these patients and you have to examine these patients. Okay, so there are just a moment. I will reduce little bit size of this. Okay, so this is called as today's topic is Nidana Pancha Panchak. So I request please write down this basic because today is the 6th of November 2023. And in this lecture, we will start with the Nidana Panchak. It will take nearly 3 lectures minimum to understand this topic, very important topic of Nidana. Please write down. Pancha Panchak. Pancha Panchak. 5 things are there to understand any disease. 5-step methods are means by which the disease can be understood. Disease is not examined. Patient is examined. But disease can be understood by 5 different ways. The first is a Nidana, then Purva Rupa, Upashaya, and Samprapti. This is the basic reference. There may be some Devanagari script, Marathi script distorted sometimes, not always. But this is reference, you write down this reference, Ashtanga Hruday, that is Vagbhat, Nidana Sthan. In the first year, it was not Nidan Sthan. Only you have learned the Sutra Sthana, first 15 chapters. But here, the reference is from Nidana Sthan, chapter 1, Ashtanga Hruday Nidana Sthan. There he has mentioned about Nidana Pancha Panchak. Say 3 times, Nidana Pancha Panchak, Nidan, Pancha, Panch, Panchak, Panchak, Nidana Pancha Panchak, Nidana Pancha Panchak, Nidana Pancha Panchak. 5 ways, please write down 5 ways to understand disease. If I want to understand Jvara Vyadhi, fever, if I want to understand Amla Pitta Vyadhi, acidity, if I want to understand Grahani Vyadhi, if I want to understand Udara ascites Vyadhi, if I want to understand Prameha, Madhumeha, every disease, we have to study its Nidana, we have to understand Purva Rupa, Upashaya, and Samprapti. In short, I will make a translation. Please write down here. Nidan is equal to cause. C-A-U-S-E, cause. मराठीमध्ये आम्ही त्याला कारण म्हणतो. या आजाराची कारण काय आहेत? याला सर्दी का झाली? Why the patient is suffering from watering from the nose? Because he has eaten ice cream. In the cold days, in the winter, he is eating ice cream. Oh my God. That is the cause. That is the Nidan of the Pratishaya, running of the nose. Why that patient is becoming diabetic? Why he is Pramehi? Why he is Madhumehi? Because sedentary lifestyle, eating only sweet things, no exercise. These are the causes for his diabetes. Are you getting? So that is Nidana. Then Purva Rupa is a prodromal symptoms, not actually the disease. The symptoms, before getting the proper symptoms of the disease, some symptoms are called as a warning. Warning bell. Warning bell is Purva Rupa. Warning symptoms, Purva Rupa. Warning bell, Purva Rupa. For example, today in the evening, if I feel, oh, I am having a little bit headache, my sore throat is not working well, it's little bit sore, I am feeling a little bit weakness, little bit, what you can say, the cold. Oh, take care. What my family members will tell me, oh, take care. Tomorrow you may suffer from the fever, viral fever. So today you take Vishranti, rest, don't take any lecture. Why? Because I am getting warning signals. That is Purva Rupa. Rupa, actual symptoms. For example, today I have got the warning signals and tomorrow This is just magic. This is just imaginary. I will not feel ill tomorrow. But if I get a viral fever tomorrow, high fever, 99 degrees Fahrenheit thermometer, severe body ache, severe headache, then okay, I have to take total rest. That is Rupa. Rupa means proper signs and symptoms of disease. Signs and symptoms of disease. There is a difference in sign and symptom. I have told already. Sign is a doctor examination and symptom mentioned by the patient. For example, if patient is saying, doctor, I have the chest pain. Oh, doctor, I have the chest pain. Then doctor examine. Chest pain is mentioned by the patient, that is symptom. Then I examined and I have found pleural rub by stethoscope, pleural rub, friction sound. Then I will say that, oh, this pleural rub is a sign, is not symptom. Examination by doctor is a sign. But in here, Rupa, both things you can understand. Then Upashaya. Actually, it is another word has not written, but you can write. There is a pair, P-A-I-R, pair, two things together. Always two things together. Upashaya, Anupashaya. Please write down. Upashaya in Marathi. Here you can see here. Upashaya. Anupashaya. That means when we advise something, therapeutical test, then sometimes the patient feel better, sometimes patient will not feel better. Okay? I will say that apply for your arthritis, apply the oil. If the patient is saying, oh, doctor, it's a good, I am getting relief, that is Upashaya. Some another person will come, doctor, you asked me to apply oil. Oh, no, not relief. That is Anupashaya. So Upashaya is a relief, Anupashaya, not relief. And last is the most important, Samprapti. Samprapti, please write down. Samprapti, they are the events. They are the events from the causative factors up to the disease. All the chain, all the line. Pathogenesis. Please write down. P-A-T-H-O. Pathogenesis. G-E-N-E-S-I-S. Patho, Vikruti. Patho means Vikruti, abnormal. Patho, P-A-T-H-O, genesis. Genesis is a creation of abnormality. How the disease is created? What is the pathology? So whole process of understanding pathology, is Samprapti. Are you getting my point? So these are the 5 things. Whenever you study any disease, Nidana Pancha Panchak. In Ayurveda, there are 2 things. Write down 2 things. Roga Pariksha and Rogi Pariksha. Different things. Roga Pariksha. Rogi Pariksha. Roga Pariksha means the examination of the or understanding of the disease. And Rogi Pariksha, understanding of the patient. Most important is a Trividha Pariksha for the patient. Inspection, Darshana, Sparshana, Prashna. Darshana, just looking. Inspection. Sparshana, touch. Palpation, percussion, and auscultation. And Prashna, interrogation, history taking. But that is the examination of the patient. Now, in this coming lecture, today and next 2 lectures, we will discuss understanding of the disease by Nidana Pancha Panchak. And first, we will discuss the only first important part, that is causes. Different classification. Too many classification methods are there to understand the cause. Let us start to understand the cause. Okay? So, Panchavidam api etat vyadhi utpatti nyapti hetu bhutam nidana uchyate. Definition by the Madhava Nidan. This is the important text of Ayurveda, Samhita, Madhava Nidan. Please write down. Like 2 things I have mentioned. Charakastu chikitsite. Charakastu chikitsite. If you want to treat Ayurvedic method, in the Ayurvedic method to the patient, management of the patient, then you must understand the principles mentioned in Charaka Samhita. Another sutra, another slogan I am mentioning, Nidane Madhavaha Sreshtaha. Please write down, Nidane Madhavaha Sreshtaha. In diagnosing, in understanding the disease process, Madhava Nidan is the best textbook. Madhava Nidan is the best textbook for the Nidan, diagnosis of the patient, diagnosis of the disease. Okay? So the word Nidan used two different contexts. Actually, there is a two ways to understand. One is a diagnosis of the disease, that is Vyadhi Utpatti Jnapti, and then etiological factors of the disease, that is Hetu Bhutam. So you must remember the Devanagari script Ayurvedic words, also its translation. There are two meanings. One is diagnosis and one is a cause. But basically we are trying to understand the causative aspect, the classification of the causes in a different methods. Nidana, that is Vyadhi Utpatti Hetuhu and Hetu Bhutam. Hetu Bhutam means causes. Next. So Nidana Paribhasha. Can you understand this? Paribhasha. Please write down. I will go slow. Paribhasha Vyakhya. Paribhasha definition. There are different definitions given in the different textbooks, Samhitas. Vyadhi Utpatti Hetur Nidanam. Madho Nidan, chapter 1. Factors which manifest the disease is called Nidan, diagnosis. Tatra Nidanam Karanam iti uchyate. Another synonym, another name for the Nidan, Karana, by Charak Nidan Sthan. There is a separate section in the Charaka Samhita, Nidan Sthan. It describes causative factors of the disease. Next, Seti Kartavyatago Rogatpadaka Hetuhu Nidanam. I am sorry, just I will try to go back. Okay, here we are. Here we are. Okay. Now I want to just take it away from this. Okay. Okay. Sa iti kartavyatako rogotpadaka hetur nidanam from Madho Nidan. I request all the students, all the viewers to learn this definition, this 100% in your brain. Say 100 times at your home. Seti kartavyatako rogotpadaka hetur nidanam iti Madho Nidan. A factor which is capable of manifesting the development of the disease either quickly or after a certain period is called as Hetu. The factor which is capable of manifesting the development of disease. You can instantly diagnose or you can diagnose after some time, that is called as a Hetu. Next, Hetur Lakshana Nirdishani Nidanani. Sushrut Sutrasthan. Nidan helps to know about etiology. Here, Hetu. Hetu. Lakshana, symptomatology. And this is pathogenesis. So we have to understand three things from Nidan. We can understand causes, we can understand the symptoms, we can understand the pathogenesis, Vikruti. Nirdishyate Vyadhir Anena iti Nidanam Madho Nidan, which gives the knowledge about the Vyadhi and directs for its entire manifestation is called as a Nidan. Nishchityam diyate pratipadyate Vyadhir Anena iti Nidanam. Certain or confirmed diagnosis of a disease is called Nidan. Nishchityam, 100%. Diyate pratipadyate Vyadhihi Anena. Certain and or confirmed diagnosis of a disease is called as a Nidan. Then Rogam Nidana Prakrupa Lakshanam Upashayapti Bhihi Ashtangrude Sutrastha. Roga should be examined. Any disease can be examined by number one, Nidana, etiological factors. Pragrupa. Here Pragrupa means Pururupa, same. Pragrupa means Pururupa, premonitory symptoms. Warning, warning, tang, 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 warning. Lakshana, that is symptomatology. Another word is Rupa. Pragrupa means Pururupa. Lakshana means Rupa. Upashaya, trial and error therapeutics. Some management has to be, it should be given. If it is good, it is okay, this diagnosis. If it is not okay, this diagnosis. I will explain when I will discuss Upashaya and Anupashaya at that time, not now, not now. And Apti, can you see Apti? Here Apti means pathogenesis. Samprapti. Apti means Samprapti. Apti means Samprapti, that is pathogenesis. Okay, next. This 10, can you see here how much definitions we have seen? Nearly, we will go again back. Can you see this is 1, this is 2, this is 3. 3 definitions, Paribhasha on this paper. Then 1, 2, 3. 3 plus 3, 6. Next. And this 7 definitions we have seen. 7. Very interesting. 7 definitions. Paribhasha, Vyakhya, definitions. Okay, next. Synonyms. How many synonyms? 10 given by Ashtanga Sangraha Nidanasthan, chapter 1. Which are the synonym? Different names. Hetu, then Nirmitta, Nirmiti, Ayatana, Sadhana, then Karaka, positive factors, Karta, main reason, Karta, Karana, media, then Pratyaya, then Samuthana, Mula means original thing in the disease. Yoni, from where the disease has developed. Yoni. Okay, so these are the synonyms, different names for the one word Nidan. Hetu, Nirmitta or Nimitta. Okay, then Ayatana. Can you see here? I think here you can see Hetu, Nimitta, Ayatana, Karaka, Karta, Karanam, Pratyaya, Samuthanam, Yoni, Mulam, Iti, Ashtanga Sangrah. So here also you can count 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. 10 synonyms are there. Okay. Now this is the classification. So many types of the classification. First, 4 types of Hetu given by Madhonidan 1 by 5. Synnikrushta Hetu. These words are little bit difficult to pronounce and write down, but I will wait and you will write down minimum things, keywords that you have to remember. Synnikrushta Hetu. Write down. I will say 2 times. Synnikrushta Hetu. Viprakrushta Hetu. Viprakrushta. Then Vyabhichari Hetu. Vyabhichari. And Pradhanik Hetu. 4 types. Synnikrushta, Viprakrushta, Vyabhichari, and Pradhanik. Now let us see what is the meaning. Bhuktam dosha prakopa. After eating, immediately after the eating completes, we have the kapha dominance. Prathama avasthapak. Kapha dominance is there. That is called as a Synnikrushta Hetu. So that's why the people feel little bit lethargic after eating the food. That is called as a immediate. Synnikrushta means very, very near to the disease. Where very near to the complaint. Okay. Then Jwara, Rukshadi Sevana. When the person is eating too much dry foods, his oja becomes less, and then Vataja Jwara will start. Viral fever will start. So that is the immediate cause. Then Viprakrushta. For example, Viprakrushta, by duration, it is connected in the long duration. Not immediate. Immediate cause. Immediate cause is Synnikrushta. And having the connection with the long time, that is called the Viprakrushta. For example, Hemante Nijita Shleshma. Hemante Nijita Shleshma. Vasante Kafaroga Krita. I will explain. Don't take tension. Very easy, very easy. What happens? You know the sequence of the Rutu. Shishira, Vasanta, Grishma. Okay? Varsha, Sharada, Hemanta. So only write down Shishira and then Vasanta. Only 2 things. Please write down. Shishira and Vasanta. Now, In the spring season, Vasanta Rutu, there are a lot of kapha problems. But that kapha problem, if the person has eaten ice cream, that is Synnikrushta. But at the same time, if he has taken a bad things, not taking precaution in the cold season, lot of kapha is accumulated in the body. Lot of kapha is accumulated in the Hemanta and Shishir Rutu. And when the sunlight comes in the Vasanta Rutu, little bit sun is more, heat is more. So because of the heat, Ayurveda says that kapha starts melting. Kapha starts melting in Vasanta Rutu. So it begins, that kapha problem has a beginning in the Shishira or the Hemanta Rutu, kapha stagnation. That is called the Viprakrushta hetu. Okay? Next, Vyabhichari. Durbalatva Vyadhi Karana Asamartha. Durbalani, though people having the low immunity will get more problem. That is called as a Vyabhichari. It is not directly related, indirectly related. These 2 points are directly related, this is indirectly related, Vyabhichari. And Pradhanik. Sometimes, in the festivals, Ganpati and all these things, sometimes they do the prasada vatapa. And whatever the food is distributed, take prasad, shiracha prasad, take the shira prasad. And because of the lot of preparation of the sweets for distribution as a prasad, there is maybe food poisoning. And all the local people who get vomiting and loose motion, all the people are admitted in the hospital, in the ICU, and they are starting some antibiotics and saline, etc. So that is a very emergency and immediate problem. That is called as the Visha, toxins. That is Pradhanik, very important cause, serious cause. That is Pradhanik. So I hope you have understood this classification. Now, 3 types of the ayatana. Trividha karana. Any disease from cold to cancer, there are 3 basic causes according to Ayurveda. That is Asatmendriyartha samyog, Pradyaparada and Parinam. Asatmya Indriyartha, 5 sense organs. Shrotra, Tvak, Chakshu, eyes, Rasana, Ghan. So when these sensory organs are getting the contact abnormal, normal, samyak yoga. If it is a hina yoga problem, ati yoga problem. For example, in the DJ music, all the time I am hearing a lot and very crowd and impossible. Lot of decibels are there. Sound pollution is there. Then that is called as Asatmendriyartha samyog. And that can cause any problem, starting from the ear problem up to your heart problem. Some people may get heart attack. Oh my God. Why? Because this is the basic cause, Asatmendriyartha samyog. Then Pradyaparada, your intelligence, you are not using your intelligence properly and you are doing wrong things at the wrong time. That is Pradyaparada. Okay? And Parinam is related with the time factor. Some diseases are because of the childhood, some are because of the young age, some are because of the old age, some are because of the Varsha Rutu problem, some having the heat stroke, sun problem. So that is Parinam. Okay? Next. Different classifications. Number 3, Dosha Hetu, Vyadhi Hetu, and Ubhaya Hetu. So Dosha Hetu, for example, if I eat a very, very spicy food at all the time, I will get a Pitta Prakopa and acidity. That is called as a Dosha Hetu. Then Vyadhi Hetu, tuberculosis, for example, tuberculosis, Mycobacterium tubercle. These are the microorganisms or the bacilli. They are very specific for the tuberculosis. That is called as a Vyadhi Hetu. Okay? Then Ubhaya Hetu. In the especially Vatarakta Vyadhi, like a gout problem, Ayurveda says that Ushtra Ashwagachanam. If you are driving all the time and if your legs are like little bit moving and they are not stable, then that can create the Vata problem. And because of the moving, there is a Rukshata and heat generation. and the patient gets the problem. Especially this is the explanation by the what you can say, the Ayurveda. But the Ubhaya Hetu means the cause which is responsible for dosha prakop and which is also causing the vyadhi. That is called as a Ubhaya Hetu. Then next is a I think we can neglect this particular thing. We can directly go for the next cause. Yes, classification continued. Two types of the hetu. For example, Utpadaka hetu, Utpadaka, and Vyanjaka hetu. Utpadaka is like Hemanta Rutu. Just now I have explained in the Vasanta Rutu, there is a kapha prakop and lot of rhinitis, cough problems are there. And that is called as a Utpadaka, immediately creating the problem. And Vyanjaka, that is Kafasya Vyanjaka Vasante Suryata. That means we can say it's like a stimulus. Vyanjak is like a stimulus. For example, if I have a lot of congestion because of the Shishir Rutu, Kapha is a Sanchit, stagnated in my body. But if in Vasanta Rutu, sun is not proper, then I may not get the problems. But so, there is a, for example, Vyanjaka is salt, salt that we are eating is also called as a Vyanjak to make our food very tasty. Similarly, in the disease process, there is a Utpadak Hetu is available, but Vyanjak Hetu is not there. Vyanjak Hetu is a sun rays. They are melting the kapha, and then Vasanta Rutu problem starts. So Vyanjak Hetu is responsible for stimulus to get that disease. Okay. Then Bahya Hetu and Abhyantara Hetu. For example, if I get any trauma, I am driving vehicle, I am not wearing the helmet and I fall down and my head injury is there. That is called as a Bahya Hetu, external injury, external anything that is coming from the external. And Abhyantara Hetu, especially inside the body, dosha prakop is there, amavastha is there. So inner problems from the body itself is called as Abhyantara Hetu, and Bahya Hetu, they are coming from the outside. Then Prakrita Hetu and Vaikrita Hetu. For example, Vasante Shleshma, Sharade Pitta, and Varsha Rutu Vata Prakop. This is called as a normal chance of getting the provocation of the doshas. For example, always in Vasant Rutu, Kapha Prakop will be there. In Sharad Rutu, October heat, Pitta Prakop will be there. And in Varsha Rutu, there will be always Vata Prakop will be there. So this is normal. Normal means not normal, but Prakrita Hetu. But Vikrut Hetu, Vasante, in Vasanta Rutu, in spite of the Kapha Prakop, if I am getting the Pitta and Vata Prakop, that is not accepted. So, how it is happening? Vasanta Rutu, we should have the Kapha Prakop. But in this particular patient, there is a Pitta and Vata Prakop. So, that is called as a Vaikruta Hetu. Prakrita Hetu and Vaikruta Hetu. Okay? If it is a Prakrita Hetu, it is easy to treat. If it is Vaikruta Hetu, problematic. Because in Vasanta Rutu, Kapha Prakop is there. If I get a cold and cough, if I do the Kapha Ghna Chikitsa internally or do the Vamana, everything will be sorted out. But now, if the patient is having Pitta Vayu problem, I cannot do the Vamana because Vata Prakop will take place. But that is difficult to treat the problems. So, Vaikruta Hetu is always difficult. The next is Anubandhya and Anubandha. So, Anubandhya is a primary or the Pradhana Hetu. And Anubandha is a Apradhana or the secondary type of the Hetu. Are you getting my point? How we can example? Always we can find out the examples. That means one is important cause and another is a secondary cause. For example, for eating too much spicy food, okay, is a primary cause of my acidity. And I have the Pitta Prakruti, then that is a supportive cause because then I will additional factor. Or if I what you can say, moving in a lot of heat, sun, that can also increase my acidity. So that is called as a secondary cause. The first problem is my eating habits. I am having the eating habits of spicy and chili. That is the main cause. And then I have the Pitta Prakriti, that is secondary cause of the disease development. Sama Hetu and Nirama Hetu. This is a typical concept. You must remember all the lakshanas of Samadosha and Niramadosha. Samavata, Niramavata. Samapitta, Niramapitta. Samakapha, Niramakapha. Please, this is homework for you. Immediately write down these shlokas from the textbook that you have purchased in any language, Marathi and English. But some homework, some self-study is very, very important. So these shlokas, 6 shlokas I have mentioned. Samavat, Niramavat. Samapitta, Niramapitta. Samakapha, Niramakapha. Please write down these shlokas and learn by heart. Okay, so that is Samahetu and Niramahetu. Ama means, what is Ama? Ama is like a toxin-like substance. Please write down. Toxin-like substance which is created because of the indigestion or faulty metabolism. Okay, next. Classification continued. One type of hetu, that is Ashaya Apakarsha Hetu. At least write down this word. Ashaya Apakarsha Hetu. Ashaya Apakarsha Gati. That is related with the concept of the strotas. And there may be some obstructions or there may be some imbalance at the different places of the dosha. I will explain you in detail afterwards. Ashaya Apakarsha Gati. But this is an important topic for the examination. They will ask you, Ashaya Apakarsha Gati means what? Ashaya Apakarsha Gati. That we will see. Next, Snnikrushta Hetu. Here you can see. Cause which is immediately responsible for the prakop of the dosha. Vata dosha is prakupita in the old age. In the young age, you get the predominance of pitta dosha. Pitta prakop will be there. In the childhood, there will be kapha prakop. If I consider the aho means daytime, then in the morning time, in the evening time, I will get the vata dosha predominance. Then in the afternoon, we get the pitta prakop 10 a.m. to 3 p.m. Then in the morning time, there is always a kapha 6 to 10 a.m. That's why vamana is always given in the morning, not in the afternoon or evening. Okay, unless and until emergence. Then ratri 2 to 6 a.m. early in the morning. Vata dosha is the predominant. That's why we get a normal defecation and urination when we wake up. Brahma murte uttishthate. Okay. Then pitta is a predominant in the midnight. So whenever any person is eating in the midnight, always he will suffer from acidity. That is not the proper time of eating. Okay. Kapha 7 to 11 p.m. That is the best time to go to the bed around 10 o'clock at night. Then bhuktam, immediately after the end of digestion, that is called as a end of the digestion, katu avasthapa, after 6 or 8 hours. If I eat, say for example, at 1 p.m., p.m. in the afternoon, I finished my lunch. Then in the evening, after 6 hours, 7 to 8, that vata dosh will be predominant and I will be more active again. But middle of the digestion, I eat at 1, finish at 1, and in the afternoon, I get a little bit thirst at 4 p.m. Then immediately after the digestion process, madhura avasthapat, immediately after the food, I have the kapha dominance, so I feel a little bit lazy. Now, Viprakrushta Hetu. The distance wise, it is on the longer distance. It is the distant, remote cause of the production of the disease. For example, Hemante Nijita Shleshma Vasante Kafaroga Krita. This is Sanskrit line from Madhav. This is not Ma. This is Madhava Nidan. Sanchaya is the accumulation of doshas is very much essential. For example, Kapha Chaya Avastha takes place in the Hemanta Rutu, where cold increases in the body. The extreme cold does not allow kapha, just a moment, does not allow kapha vilayan to take place. Therefore, kapha prakop not occur in the Hemanta Rutu. However, in the Vasanta, the change in temperature, as it becomes more and more warm, will do the kapha vilayana, melting of the kapha, and kapha prakopa will take place and lead to the manifestation of cold, cough and respiratory problems, that is Kapha Roga, in Vasanta Rutu. Sanchaya is in the previous Rutu, Shishir and Hemanta, but Vilayana will be in the Vasanta Rutu. Chaya and Prakop of dosha as per the season here. Vata Chayavastha Grishma Rutu. That is called as a remote cause, a remote problem. Then Prakop in the Varsha Rutu, Vata Prakop, and Prashama in the Sharad Rutu. This table is very important for all time of your life. Pitta Chaya, Chayavastha, Varsha Rutu, Prakop in the Sharad Rutu, and Prashama in the Hemant Rutu. Kapha, Chayavastha in the Shishir Rutu, Prakopavastha in the Vasanta Rutu, and Prashama in the Grishma Rutu. So accumulated Kapha in the Hemanta Rutu manifest Kaphaja Vikara in the Vasanta Rutu. Accumulated Pitta in Varsha Rutu manifest Pittaja problem like the burning of the eyes, burning of the hands and feet. They are in the Sharad Rutu, October heat. Accumulated Vata in the Grishma Rutu manifest Vataja problem like joint pain, bronchial asthma, Sandhivata, Dama, Shwasavyadhi in the Varsha Rutu. Next. That is Vyabhichari. Causes which are weak, that is Durbala, and which do not have enough strength to produce the disease, they are called as a Vyabhichari. But which act as a carrier when favorable situation or condition for manifestation of disease, immediately Vyadhi will start. For example, diabetes is a Vyabhichari for corona. Vyabhichari for corona format. There is a virus that is causing the immediate cause, that is called corona. But Vyabhichari means it is a supporting cause. Vyabhichari, supporting cause. If the person is having any other diseases like cardiac problem, bronchial asthma problem, diabetes problem, hypertension problem, then he get the corona more easily. But that is not the main cause. That is Vyabhichari cause. Diabetes, hypertension, etc. Pradhanik toxins. It is the powerful cause that produces the disease instant, like the poison. Bluish discoloration in Visha Sevana, cyanosis. You know the cyanosis? Bluish discoloration in the nails or in the central cyanosis and peripheral cyanosis. Okay. Sudden manifestation of symptoms are seen. Like for example, you are having the bite from the rabid dog. Pisalela kutra चावणं, rabid dog bites. That is called as a Pradhanik hetu. Snake bite, cobra. That is called Pradhanik hetu. Immediate ICU admission. Accumulation of dosha is not necessary. Agantuja, external causes may be included under Pradhanik hetu. Like for example, accident, road accident, immediate Pradhanik. Okay. Shalya, accidents, poisoning, strangulation, suffocation, injury, burn, all these are the Pradhanika hetus. Okay. Then three subtypes. Dosha hetu, normal accumulation, aggravation and pacification of dosha takes place in the respective season. Just now we have seen dosha, prakopa, etc. Then Vyadhi hetu, those which are responsible for development of specific disease by specific etiology. For example, regular consumption of MRD manifest MRD Bhakshajanya Pandu, Mrudha Bhakshana Janya. Eating the mud, please write down, eating the mud. It is called as a Paika, P-I-C-A. Please write down, Paika, P-I-C-A, P-I-C-A. Paika means mud eating, wall eating. The small children, they do that because they are craving for iron and calcium. They are having deficiency of iron and calcium. That's why they eat the sand. They eat the chalk pieces. They eat the wall color. Are you getting my point? So this is a deficiency. But Ayurveda says that particular disease is called as a Mrudha Bhakshana Janya Pandu. Pandu is the anemia. In modern science, it is called as a mud eating or Paika disease. P-I-C-A, Paika disease. Intake of Kulatha. a typical grain, horse gram. Please write down, horse gram. If you take the excessive kul, but I think instead of kulat, we can say eating of everyday chili. Everyday chili eating. That is also called as a amlapitta vikar. That is a vyadhi hetu. Consumption of the mouse in excess that can manifested as a, what you can say, here shleshma pitta vikar, shleshmika pitta vikar, kapha pitta vikar. Next, ubhaya hetu. Specific factors which aggravate the vata and rakta and simultaneously manifest vata rakta vyadhi. Here causative factors aggravate dosha and simultaneously manifest the disease. As I have mentioned, traveling on the vehicle with the limbs like moving. That is a typical explanation given in the Samhita. You can find out another ubhaya hetu type of the causes. Now, utpadaka hetu. Utpadaka. Those causes which favors accumulation of respective dosha in the respective season, they are called as utpadaka. For example, in Hemanta Rutu, due to the Madhurasadi substances, accumulation of kapha is there. That is utpadaka. Beginning is there. Then, what is that? Here utpadaka and here vyanjaka. Those which stimulate the development of disease. For example, accumulated kapha in Hemanta manifest disorders in the kapha in Vasanta Rutu because of the effect of sun rays. That is called as a vyanjaka hetu, stimulant. Bahya and abhyantara. Diseases manifest due to the consumption of mithya ahara vihara. That is called as a bahya hetu. Vihara and kala. Then vatadi dosha prakop hetus are included under the bahya hetu. Excessive traveling, excessive over air pollution you are getting, that is bahya hetu. And abhyantara hetu, internal factors which disturb the dosha and dusha are called as the abhyantara hetu. Okay. Next we will go further. Prakrita and Vaikrita dosha that we have already seen, hetu. Prakrita hetu, those which manifest naturally due to the variation in the season and accordingly aggravation of the dosha results. For example, kapha prakopa in Vasanta Rutu. That is Prakrita. Pitta prakopa in Sharad Rutu. And Vata prakopa in the Varsha Rutu. Vaikruta hetu, those which manifest due to the abnormal season. Abnormal. Vasanta Rutu, if there is a Pitta and Vayu prakop, that is abnormal. That is called as a Vaikruta. In Varsha Rutu, if you get, in spite of Vata, you get the Kapha Pitta Prakop, that is also abnormal. And in the Sharad Rutu, in spite of Pitta, you get Kapha Vata Prakop, that is also abnormal or the Vaikruta Hetu. Understanding the normal and abnormal aggravation of dosha as per the influence of Rutu is essential to understand the prognosis of disease. I have already mentioned that. If it is a normal Prakrut Hetu, treatment is easy and prognosis is Sadhya Sadhyatva. Please write down. Prognosis, Prognosis, whether the disease will be curable, difficult to cure, or it is not possible to cure. That is called as a Sadhya Sadhyatva prognosis. Okay. So by this you can understand this prognosis. Then Anubandhya and Anubandha. Little spelling difference. Try to note this. Anubandhya and this is Anubandha. Anubandhya is a primary cause and Anubandha is a secondary cause. What is next? Ashayapakarshya gati means normal equilibrium condition of doshas moves from their own place by influence of vata and produces the disease. Are you getting my point? For example, if the person is eating a lot of what you can say the ice cream, then that kapha dosh is carried to the respiratory tract, especially the noses and sinuses and the bronchi, and lot of secretions will be there, and the diseases are created. But at the same time, if there is another cause of the kapha prakop, for example, if the person is taking in the cold season the bath with the cold water, bath with the cold, that particular kapha will be moved to all the joints and the patient will start arthritic problems. So this is a ashaya from specific place. Kapha dosha sthana, you know, urak kantashiraha, kloma parvani, amashya rasaha, medo granam jivache, kafasya sutramurha. From these places, that kapha is taken at a different places and the particular diseases is created. So ashaya apakarsha gati. Gati is a movement. Taking away the different doshas at different places is called as a ashaya apakarsha gati. So my dear friends, I think this is something interesting topic about the Nidana, and we will try to see the different classification and with different examples. So in last 10 minutes, I would like to revise something. And I would like to ask you to write something. Roga Pariksha, Roga, understanding disease, is done by Nidana Pancha Panchak and Rogi Pariksha. Please write down Rogi, examination of the patient. So there are, for example, Trividha Pariksha. Example, write down the example. Darshana, Sparshana, Prashna. Then there may be Dashavidha Pariksha. There may be Ashtavidha Pariksha. That we are going to see afterwards. Today we are only concentrating Nidana Pancha Panchak, because in Charaka Sutra Sthan they have mentioned Rogam Adau Parikshet Tato Anantaram Aushadam. Rogau Adau begin with. First understand the disease and then give the medicine. Then only you will be successful. Don't be hurry to give the medicines. No. First understand the disease, examine the patient, and then give the medicine. So understanding dosha is started with the causes. Nidan, causes. Causes are very important. Why? Why they are important? Please write down why they are important. Why causes are important? I am giving you the shloka. Please write down. Sanshepataha. Sanshepataha. Kriya yogo. Nidana parivarjanam. Sanshepataha. Kriya yogo. Nidana parivarjanam. Sanshepataha. Kriya yogo. Nidana parivarjanam. Ayurveda says, what is the treatment? Treatment is nothing but to avoid the causes, to treat the causes. For example, if the patient has having sedentary lifestyle and only eating sweets, and you are treating the diabetes. For example, you are giving modern drugs, modern medicine, or you are using Ayurvedic medicines. For example, Gudamar Churna, Chandraprabha tablet. But giving that will not cure the diabetes. No. First, you treat the cause. Ask the patient, do not eat the sweet things. That was the cause. Do not be lazy and keep sedentary lifestyle. No. Do the exercise. So we are trying to remove the causes. We are trying to correct the problem, correct the causes. Faulty lifestyle, faulty food, we must correct it and then give the tablet. Otherwise, your tablet will not work. Your insulin will not work. Insulin resistance will be there. Okay. So now we will discuss about the different causes. For example, Snnikrushta, Snnikrushta and Viprakrushta. For example, bronchial asthma. Another example, bronchial asthma patient. Whenever there is a cloud in the black clouds and the whole atmosphere is like soon rain will start. That particular thing is an immediate cause. Attack will start. Attack will start. Are you getting my point? Bronchial asthma patient will start the breathlessness attack when there is a cloud in the sky, black clouds, rainy season, rainy atmosphere, then the attack will start. That is a Synnikrushta cause. And Viprakrushta, what is Viprakrushta? Just now we have discussed a lot of things, but the causes which will make your respiratory tract very, very weak. For example, if you take the case of bronchial asthma, what can be the Viprakrushta? Smoking, chain smoker, that can be the another cause, but is not immediate cause. Immediate cause is a rainy season, rainy atmosphere. But the Viprakrushta cause is smoking. Okay. Vyabhichari. Vyabhichari, as I have mentioned, actually, Vyabhichari cause is tricky. That means cannot create a disease at every time. Vyabhichari cause is not created the disease every time. For example, if one is taking the kapha prakopak ahar vihar, he is eating a lot of sweet things, but still he may not get the diabetes. He may not get the prameya. Why? Because eating only sweet is not the exact cause, only cause for the diabetes. There are a lot of causes together. So eating only sweet things is a Vyabhichari cause. That means it is not sure that 100% the patient will get the diabetes. Okay. Next, Pradhanik, we have discussed a lot, the toxins, water pollution, contamination of the food, contamination of food poisoning is a Vyabhichar, or accidents, trauma, that is a, Pradhanika hetu. Next, we have discussed about the Asatmendriyartha samyog, Pradyaparada and Parinam. These are the three important causes that we have discussed. In short, I will tell you the definition of Pradyaparada. Dhi dhriti smriti vibrashtaha yat kurute ashubham pradyaparadham tam vidyat sarvadosha prakopanam. This is the classical shlok that you will search in your own purchased textbook and write down the definition of Pradyaparada. Okay. Then dosha hetu, vyadhi hetu and ubhaya hetu. That also we have discussed. Dosha hetu, for example, with relation to the test, madhur, amla and lavana. Madhur, amla, lavana, they are the kapha prakopak test. If you eat a lot of madhura, lot of amla, lot of lavana, that will increase the kapha problems. That is dosha hetu. Then eating a lot of spicy things, that makes the pitta prakopa. Vyadhi hetu, the mentioned in the text is a mrudha bhakshana janya pandurod, mrudha bhakshana, paika, eating the mud. But I have already mentioned the example of typical microorganisms. For example, there is a specific organisms for tuberculosis, specific organisms for the leprosy, specific cause like alcohol taking is a cause of liver cirrhosis. So they are the specific, or the smoking is a cause of lung cancer. So this is a vyadhi hetu. Okay. Then there is another specific term. It is also asked in the examination. Aupasargika vyadhi. Please write down. Aupasargika. That is communicable diseases. Mentioned by Sushruta. Please write down. Sushruta Nidan Sthan, chapter number 5. Sushruta Nidan Sthan, chapter number 5. Aupasargika roga. Please write down. Aupasargika roga. Prasangat, gatra sansparshat, nishvasat, sahabhojanat, sahashayyasanat chapi, vastra malyanulepanat, kushtham, jwaram, shoshaha cha, netrabhishand evacha, aupasargika rogascha, sankramanti naradnaram. Sankramanti naradnaram. From one person to another person, the disease is shared. For example, if you have the conjunctivitis, Marathi madhe आम्ही त्याला डोळे येणे असं म्हणतो, conjunctivitis. If we use this handkerchief and another my son or another person is using the same handkerchief, he will get also the conjunctivitis, netrabhishand. So this concept, aupasargika roga, is very important for the examination point of view. So my dear friends, today we have discussed a lot about the different types of the Nidana. You study it, you make your own notes by different examples. If you have any difficulty, you can definitely write in the comments or WhatsApp me on 9226 at 10630. Tomorrow we will continue with another lecture. For example, in the afternoon from 3:15, 2 to 3, we will first discuss some part of the, I think, Charak Uttarardha. And in the immediately after 3:15 to 4:15, we will discuss the gynecological or Stri Roga Prasutantra type of the topic. Okay. So thank you very much for your nice cooperation. See you tomorrow. Till then, have a nice evening. Thank you very much and take care.